The son of immigrants who came here seeking the American dream, Andrew Yang. His parents taught him about hope and hard work, a leader in education. Andrew Yang, the founder of Venture for America, a nonprofit that helped create thousands of jobs. President Obama named Andrew a champion of change, and his ideas are a blueprint for a new way forward. An economy where big tech and Wall Street are held accountable. A healthcare system with Medicare for all that takes on drug companies to lower prices. A fight against climate change that confronts big polluters.
We have to rewrite the rules of the 21st century so that they work for us.
Andrew Yang, parent, patriot, not a politician. A new leader who understands that what's coming is the greatest economic transformation in history and who can lead us in the fight for the future that we want. For President Andrew Yang, a new way forward.
I'm Andrew Yang, and I approve this message. We are experiencing the greatest technological and economic shift in human history. We need a way to help millions of Americans transition through this period, and a universal basic income is the best and most efficient way to do that. Hello, I'm Andrew Yang, and I'm running for president as a Democrat in 2020. I believe I have the right vision, priorities, and values to improve the lives of millions of Americans. 7 years ago, I started Venture for America to train hundreds of young entrepreneurs to build businesses in Detroit, Cleveland, Baltimore, and other communities across the country. Together, we helped create thousands of jobs. But during this time, I came to realize that technology has already wiped out 4 million manufacturing jobs in Ohio, Michigan, Pennsylvania, and other states. And it's about to do the same thing to people who work in retail, food service and food prep, customer service, transportation, as well as industries like insurance, accounting, medicine, and law. I saw so much over the last number of years traveling this country. What I experienced was an eye-opener to me, where I would walk through abandoned neighborhoods and boarded up businesses. I have 2 young boys, and I'm deeply concerned about the future that they're going to grow up in. If we don't change things dramatically, they're going to grow up in a country with fewer and fewer opportunities, and a handful of companies and individuals reaping the gains from new technologies while the rest of us struggle to find opportunities and eventually lose our jobs. And it doesn't need to be that way. Under my plan, every American adult will receive $1,000 a month, free and clear, paid for by a new tax on the companies that are benefiting most from automation. If we provide a universal basic income, Americans will be able to go back to school, move for a new opportunity, start their own business, and really have their head up as they plan for the future. With your help, we can make universal basic income a reality. Join us, and let's build a new kind of economy, one that puts people first.
I think being a parent changes your outlook on everything. Suddenly you're living for something greater than yourself, and you are interested in protecting our society, our culture, our environment for future generations. And I think that is why he decided to run for president. Andrew saw the problems that nobody else saw, and he saw that the best solution was something called universal basic income, which it sounded too good to be true. But the more he talked to me about it, I thought, wow, if this is possible, this will be the greatest thing to ever happen in our society, especially in terms of helping women who still make up the majority of the poor in our country. We all know at least one woman who's stuck in a bad situation where they rely on someone financially or they're in a job that exploits them. The freedom dividend would be such a game changer. You know, Andrew has said that women do the hardest, most unrecognized work in our society. And it's true. You know, I've been a stay-at-home mom and I've worked at companies large and small, and hands down, being a mom is the hardest job. And just because I don't get a paycheck doesn't mean that there isn't value in that work. So I love the way that Andrew has reframed what work means, and nobody else would step up to do this if not for him.
Universal basic income sounds like science fiction, a utopian dream, but it's no fantasy. It's as fundamental as clean air and clean water, a good education, or healthcare. It's a floor on which to stand, an inheritance we're owed, a share in our society, a dividend that pays through our whole lives. We need more than wages. We need capital, because capital grows, and capital is power. The power to live, the power to create, the power to share, the power to choose. We call that power freedom. It's what we fight for, what we march for, what we vote for. We owe it to ourselves. Let's collect the check. Let's collect the freedom dividend. Vote for Andrew Yang as the Democratic nominee for president in 2020. We owe it to ourselves.
The son of immigrants who came here seeking the American dream, Andrew Yang. His parents taught him about hope and hard work, a leader in education. Andrew Yang, the founder of Venture for America, a nonprofit that helped create thousands of jobs. President Obama named Andrew a champion of change, and his ideas are a blueprint for a new way forward. An economy where big tech and Wall Street are held accountable. A healthcare system with Medicare for all that takes on drug companies to lower prices. A fight against climate change that confronts big polluters.
We have to rewrite the rules of the 21st century.
All right, mic check. Everyone in the chat can hear me okay?
Parent, patriot, not a politician. A new leader who understands that what's coming is the greatest economic transformation in history and who can lead us in the fight for the future that we want. For President Andrew Yang, a new way forward.
I'm Andrew Yang, and I approve this message. We are experiencing the greatest technological and economic shift in human history. We need a way to help millions of Americans transition through this period, and a universal basic income is the best and most efficient way to do that. Hello, I'm Andrew Yang, and I'm running for president as a Democrat in 2020. I believe I have the right vision, priorities, and values to improve the lives of millions of Americans. 7 years ago, I started Venture for America to train hundreds of young entrepreneurs to build businesses in Detroit, Cleveland, Baltimore, and other communities across the country. Together, we helped create thousands of jobs. But during this time, I came to realize that technology has already wiped out 4 million manufacturing jobs in Ohio, Michigan, Pennsylvania, and other states. And it's about to do the same thing to people who work in retail, food service and food prep, customer service, transportation, as well as industries like insurance, accounting, medicine, and law. I saw so much over the last number of years traveling this country. What I experienced was an eye-opener to me, where I would walk through abandoned neighborhoods and boarded up businesses. I have 2 young boys, and I'm deeply concerned about the future that they're going to grow up in. If we don't change things dramatically, they're going to grow up in a country with fewer and fewer opportunities, and a handful of companies and individuals reaping the gains from new technologies while the rest of us struggle to find opportunities and eventually lose our jobs. And it doesn't need to be that way. Under my plan, every American adult will receive $1,000 a month, free and clear, paid for by a new tax on the companies that are benefiting most from automation. If we provide a universal basic income, Americans will be able to go back to school, move for a new opportunity, start their own business, and really have their head up as they plan for the future. With your help, we can make universal basic income a reality. Join us and let's build a new kind of economy, one that puts people first.
I think being a parent changes your outlook on everything. Suddenly you're living for something greater than yourself, and you are interested in protecting our society, our culture, our environment for future generations. And I think that is why he decided to run for president. Andrew saw the problems that nobody else saw, and he saw that the best solution was something called universal basic income, which it sounded too good to be true. But the more he talked to me about it, I thought, wow, if this is possible, this will be the greatest thing to ever happen in our society, especially in terms of helping women who still make up the majority of the poor in our country. We all know at least one woman who's stuck in a bad situation where they rely on someone financially or they're in a job that exploits them. The freedom dividend would be such a game changer. Andrew has said that women do the hardest, most unrecognized work in our society. And it's true. I've been a stay-at-home mom and I've worked at companies large and small, and hands down, being a mom is the hardest job. And just because I don't get a paycheck doesn't mean that there isn't value in that work. So I love the way that Andrew has reframed what work means, and nobody.
All right, hello, Yang Gang. I'm going to take a quick moment and make sure that all of my technology is working well. If you have ever tuned into a stream of mine before, you know that technological difficulties are something that happen quite frequently to me. So before we get started, I'm just going to make sure I got some thumbs up in the chat. Thank you so much for watching. I am here today to read Andrew Yang's healthcare plan so that you don't have to, because who has time for that in this day and age? Good morning, everyone. Happy Monday. I hope you're having a good start to your week and your morning commute went well, and hopefully you're having a good time at your job. That's a huge thing for me. I want people to be happy with the work they're doing in life. I'm just going to keep on waiting here. It looks like my delay's a little bit off here, so I won't get the first feedback for a little bit. So, oh man, I'm just gonna take a quick moment. Take some deep breaths. I want to be able to cut this and be able to upload it later as a fully post-edited video, so you can go and see it. If for any reason you have to leave during the stream, I'll upload it later today, so you can come back and watch it. So you can save any time you need on reading. Perfect. It looks like we're good to go. Okay, so from what I've been hearing in the Twitter sphere, blogger sphere, everything, is that this is actually meant to be kind of a two-part Medicare for All proposal, and some people are expressing a little bit of frustration with the idea that this isn't a fully coherent policy proposal. We'll have to see about that. Someone recommended that I go ahead and just read the very first Medicare for All policy proposal on his website before we get into what he released today, so we're going to do that very quickly here. All right, so policy Medicare for All. We are having the wrong conversation on healthcare. Instead of addressing the underlying problems driving unaffordability and access, we Democrats are spending all of our time arguing over who is the most zealous in wanting to cover Americans, over who has wanted to do so longer, over who cares more about the health of Americans. Pardon me for just a second. I want to make sure that this is the correct. Yeah, okay. Yeah, we're good. Thank you. Let's see. We talk about how we're going to pay for it, but the reality is we're already paying for it. We pay for it when we can't switch jobs. We pay for it when new jobs are temp or gig jobs that don't provide health care. We pay for it when all of our prices are higher. We pay for it when healthcare costs drive us into bankruptcy. To be clear, I support the spirit of Medicare for All, and I have since the first day of this campaign. I do believe that swiftly reformatting 18% of our economy and eliminating private insurance for millions of Americans is not a realistic strategy, so we need to provide a new way forward on healthcare for all Americans. As Democrats, we all believe in healthcare as a human right. We all want to make sure that there is universal, affordable coverage. We all know that we have a broken healthcare system where Americans spend more money on healthcare to worse results, but we are spending too much time fighting over the differences between Medicare for all who want it, and ACA expansion when we should be focusing on the biggest problems that are driving up costs and taking lives. We need to be laser focused on how to bring the costs of coverage down by solving the root problems plaguing the American healthcare system. That means controlling the cost of prescription drugs. That means investing in innovative technology to cut waste and boost access. That means changing the incentive structure for providers. That means shifting our focus on more stages of care. That means revamping what comprehensive care means in the 21st century to include crucial aspects of well-being. That means taking on the powerful lobbyists in DC. Diagnosing and addressing these underlying problems is the first and most important step in ensuring everyone has access to healthcare, because we cannot extend quality coverage to everyone without real strategies on how to avoid the toxic incentives of our current system. We can't afford to mess this up. Fundamentally, we need to have a more productive conversation about healthcare in America. It's time to take a step back from enrollment mechanisms and creative accounting to focus on lowering costs and improving quality. My full plan for a new way forward in healthcare in America and a statement of the critical failings of our system and viable paths to solve them. We cannot find the answers to one of the most serious problems in modern American history unless we are asking the right questions. It's time we start asking the right questions. And that links over to what was released just today, A New Way Forward for Healthcare in America, written today, December 16th, 2019 by Andrew Yang. And from what I understand, the very first beginning of this is actually quite similar, so I don't want to have to read the same thing over again. Let's go ahead and see exactly. Okay, let's just start right here. We need to be laser focused on how to bring the costs of coverage down by solving the root problems plaguing the American healthcare system. That means controlling the cost of prescription drugs. That means investing in innovative technology to cut waste and boost access. That means changing the incentive structure for providers. That means shifting our focus on more stages of care. That means revamping what comprehensive care means in the 21st century to include crucial aspects of well-being. That means taking on the powerful lobbyists in DC. Diagnosing and addressing these underlying problems is the first and most important step in ensuring everyone has access to healthcare, because we cannot extend quality coverage to everyone without real strategies on how to avoid the toxic incentives of our current system. We can't afford to mess this up. Fundamentally, we have to have a more productive conversation about healthcare in America. It's time to take a step back from the enrollment mechanisms and creative accounting to focus on lowering costs and improving quality. We need to fix our broken healthcare system by tackling the root problems through a six-pronged approach. 1. Control the cost of life-saving prescription drugs through negotiating drug prices, using international reference pricing, forced licensing, public manufacturing facilities, and importation. 2. Invest in technologies to finally make health services function efficiently and reduce waste by utilizing modernized services like telehealth and assistive technology, supported by measures such as multi-state licensing laws. 3. Change the incentive structure by offering flexibility to providers, prioritizing patients over paperwork, and increasing the supply of practitioners. 4. Shift our focus in educating ourselves in preventing care and end-of-life care options. 5. Ensure crucial aspects of well-being, including mental health, care for people with disabilities, HIV and AIDS detection and treatment, reproductive health, maternal care, dental, and vision are addressed and integrated into one. Comprehensive care for the 21st century. 6. Diminish the influence of lobbyists and special interests in the healthcare industry that makes it nearly impossible to draft and pass meaningful healthcare reform. My plan is a statement on the critical failings of our system and viable paths to solve them. We cannot find the answers to one of the most serious problems in modern American history unless we are asking the right questions. It's time we start asking the right questions. 1. Controlling prescription drug cost. Why do prescription drugs in this country cost so much? Individual drugs change prices at the whims of those running pharmaceutical companies. Brand-named prescription drugs prices have risen 76% over the last 6 years, and they're not slowing down. Patent trolls, or non-operating companies that extract cash settlements from companies they accuse of patent infringement can drive the prices of certain medications up while providing no value themselves to the U.S. healthcare system. I see something going wrong on my device here. I just want to make sure that the live stream is still continuing and active. Is this stream still going on? Do I get a thumbs up in the chat? Because it has stopped on my secondary device. And I just don't want to sit here and continue to drone on and on for no one's benefit. Right? Anyone? Let me see. I'm re-uploading this at the moment. Okay, cool. It looks like we're all good to go. Thank you for that slight intermission here. Let's continue along. They can drive the prices of certain medications up while providing no value to themselves or the U.S. healthcare system. And while drug companies complain constantly about the high cost of research, they fail to mention that almost all FDA-approved drugs over the past several years relied on basic research funded by the National Institute of Health, the NIH. They also don't mention the record-high profits they've been experiencing in recent years. While drug companies bring in only 23% of healthcare's U.S. revenue, they make 63% of the total profits. In 2017, Purdue Pharma alone earned more than $35 billion from OxyContin sales. It's making it impossible for Americans who need drugs to afford their treatment. Many are choosing between their medicine and food or shelter. The runaway growth in drug prices since the turn of the century has led to the U.S. per capita spending on pharmaceuticals to exceed $1,000 a year, hundreds more than our peers in France, Germany, or the United Kingdom. We need to put pressure on these companies to get their prices under control and more in line with the rest of the world. Americans pay twice as much as Australians and 3 times as much as the Dutch on prescription drugs due to lack of price control. We have to give the federal government authority to negotiate drug prices and use standard international price reference points so pharmaceutical companies can no longer exploit our market to the American people. If these companies are not willing to compromise, we need to ensure the U.S. government has the ability to force licenses for these drugs to companies who will. Additionally, we need to authorize the creation of public manufacturing facilities to make these drugs, as well as other necessary drugs and unprofitable but necessary medications for the American people. If all else fails, we need to allow the importation of medication from other countries. As president, I will work with Congress to pass as a typo, very first typo I've seen, work with Congress to pass laws to negotiate drug prices, use international reference pricing to set a baseline, and allow for forced licensing of medications if companies can't come to a reasonable agreement with the federal government on cost in line with international prices. Create public manufacturing facilities to produce generic drugs and produce drugs through a forced license to keep cost at a minimum. Also, manufacture unprofitable medications and important high-demand medications. If all of the above fail, allow for the importation of prescription drugs from other countries. 2. Invest in innovative technology. Can innovation help reduce healthcare costs? The advancement of health and communication technology has the potential to increase access to care while reducing overhead. We should invest in expanding existing technologies to reach those in underserved areas, especially the 77% of rural counties that are considered rural primary care deserts, 9% of which have no physicians at all. With greater telehealth infrastructure, we can help nurse practitioners and other health professionals provide a higher level of care under the digital supervision of a doctor. By harnessing the power of technology, we can ensure that the healthcare system functions more efficiently and effectively. Utilizing telehealth to meet provider demands. The demand for physicians is outpacing the available supply, and the shortage is causing problems for the nation's growing and aging population. Telehealth is an effective approach for doctors across the country to provide care for patients in rural and underserved areas over the internet without needing a specific redundant license to practice medicine in the patient's state. Utilizing telehealth will enhance the quality of life and reduce hospital visits while curbing deaths from chronic disease. Patients will be able to access treatment that may not be conveniently located. About 62% of rural counties are not equipped to provide services such as diabetes self-management education and support, DSMES. Numerous case studies have illustrated the benefits of telehealth for DSMES so far. For example, once a rural clinic in Montana implemented it, 61% of participants began monitoring their blood sugar accurately after just 6 months, an improvement from 31% pre-telehealth. The services have also shown positive results for mental health, stroke treatment, cardiac rehabilitation, and cancer treatment. Medication abortion has similar efficacy. that's not the right pronunciation. Someone's gonna correct me on that, but it's okay. Of terminating early pregnancy as in-person abortions. Enlarging the geographical footprint of medical providers through telehealth can improve access to abortion in the 27 U.S. cities with populations greater than 50,000 people that have no abortion clinics within 100 miles. Telehealth is a cost-effective alternative to the more traditional face-to-face way of providing medical care and has the potential to save billions annually while improving healthcare related to strokes, cardiac services, diabetes, and epilepsy. Ensuring healthcare for all also requires federal regulation of telehealth and expanding it in a way where we can distribute services and treatment. As president, I will encourage the use of telehealth in rural areas and for mental health services. Invest into the use of telehealth in rural areas, including ensuring broadband access for 99.9% of Americans. Allow licensed physicians to administer medical services and medication through telehealth services. Assistive technology to boost coverage. As we continue to invest, my phone's doing the same thing again, and I just want to make sure here that everything's still bueno and copacetic. Unfortunately, I do live in the South, and the internet coverage here is a little wacky. I'm one of the the people he's talking about right here, believe it or not. Let me just quickly take a look. Okay, we're still copacetic. Good, great. As we continue to invest in medical innovation, we must integrate assistive technology into the primary care provided by doctors and nurses. Existing technologies like telehealth and emerging technology like medical AI must be leveraged to expand care. Working together through telemedicine, teams of nurses, AI, and doctors will be able to provide care to thousands of Americans that currently have limited access to healthcare. As this technology advances, we need to trust in our nurses and nurse practitioners to provide care that's historically the responsibility of MDs. This will be essential in providing access to care across rural areas and can even be supervised by a doctor through a telehealth system. This new system, combining the best of AI, telehealth, and professional expertise, will allow for a more flexible and responsive health force without sacrificing quality of care. As president, I will invest in the development and deployment of medical technology in rural areas to assist nurse practitioners and other professionals in administering vital care in areas where an MD is not physically present. Multi-state licensing and federal registration for physicians. Human anatomy doesn't change across state lines, but doctors are still required to obtain medical licenses for each state they practice in. These onerous relicensing requirements discourage qualified doctors from providing essential care through telemedicine to those in other states. We must streamline the licensing system and introduce a single, comprehensive telemedicine license that, once granted, will allow care providers to see patients in all 50 states. Federal regulation of medical licensing will remove friction and encourage doctors to start practicing telemedicine and will make inroads into primary care deserts. As president, I will implement federal regulations over telehealth, implement federal medical licensing to physicians to practice telehealth across state lines. 3. Improve the economics of healthcare. How do we improve the economic incentives of our healthcare system? Like any other industry in the country, the healthcare system in America has evolved into the mess it is today because the incentive structure allowed it to do so. So let's change it. We can rebuild and modernize the electronic health record to minimize the hours doctors spend on administrative tasks. This way, we can get doctors back to seeing patients and spending less time behind computer screens. Let's move to a system that incentivizes maximizing health instead of administrative activity. Let's free practitioners to focus on doing their jobs, unencumbered by administration or unaligned incentives. Transition to 21st century payment models. Most doctors are still compensated through the fee-for-service model. This model pays doctors according to how many services they prescribe and thus incentivizes them to do unnecessary tests and procedures. This model wastes hundreds of billions of dollars every year. To get these wild costs under control, we should follow the lead of the Cleveland Clinic and the Mayo Clinic and help transition doctors onto a salary model. We can incentivize hospitals and clinics to adopt the salary model through cost savings and ease of billing process. This will allow doctors and administrators to focus on patient care instead of Byzantine payment models with insurance companies. To give hospitals the fiscal freedom they need to transition doctors to a salary model, we should explore the capitation payment model. This would mean that hospitals could receive lump sums based on their patient intake instead of using complicated fee-for-service arrangements. Any capitation payment method would be responsibly calibrated to ensure the doctors aren't forced to see more patients than they can handle, and low-intake rural hospitals receive enough funds to cover their operating costs. A model in which hospitals are paid through capitation and in turn pay physicians on a salary can align incentives so that patient care and compensation are on the same side. Doctors will be paid for by providing great patient care, not for prescribing them unnecessary tests and procedures. This would allow doctors to focus on patients' health in the most effective way instead of the most expensive. This performance-based payment system incentivizes physicians to consider best practices for providing quality preventative health. It's not only cheaper to take care of a healthy person rather than treat an ill person, it keeps people healthier by ensuring they see a doctor for their illness rather than self-diagnosing and risking negative consequences from improper treatment. As president, I will work with clinics and hospitals to increase the use of salary-based compensation for doctors, explore capitation payment options for health providers, and utilize the use of electronic records to track success. Move away from defensive medicine. Doctors operate under constant threat of malpractice lawsuits. These cases are only decided by a verdict 5% of the time, and when they are, they land in the doctor's favor 80% of the time. Despite the fact that doctors are almost always exonerated, malpractice suits can take years. As a result, doctors often prescribe needless procedures and tests to avoid being sued. I just realized I haven't been recording this the entire time I have been speaking, so I'm not going to be able to post-edit it and upload this later today. I might as well start now, but holy crap, I'm so pissed at myself. All right, okay, no, we're going on. We're doing it live. We need to allow doctors to practice medicine that prioritizes their patients' health without legal fear in the back of their minds. In order to do this, we must reform the bloated tort system that makes up a larger percentage of GDP in the U.S. than other developed countries. As president, I will discourage doctors from practicing defensive medicine by making them less vulnerable to frivolous malpractice lawsuits and providing institutional support to doctors, resulting in an increase in time spent with patients. Decrease administrative waste. Today, doctors spend 2 hours doing paperwork for every 1 hour they spend with a patient. This explosion of administrative tasks is due in large part to the adoption of the Electronic Health Record, EHR. The record was supposed to ease the documentation and billing processes, but its poor construction has made doctors spending 6 hours a day on administrative tasks. We must leverage existing technology to automate routine administrative tasks and rebuild the EHR from the ground up. Opening up the vendor process to include third-party developers or standardizing APIs across EHR could incentivize innovation and create a race to the top. This will allow doctors to spend more productive time doing what they love, treating patients. It will also reduce the high doctor burnout rate that costs healthcare $4.6 billion every year. As president, I will direct the complete overhaul of the electronic health record with an emphasis on modernization and ease of use. Incentivize innovation in EHR by opening up vendors to include third-party developers and explore standardizing APIs across EHR. In order for everyone to receive primary preventative care, we need more doctors. We currently have a shortage of doctors, and the problem is only going to get worse if we don't make some changes. The astronomical cost of medical school is also a disincentive because becoming a lower-paid primary care doctor does not make sense for medical students with hundreds of thousands of dollars in debt. We must take immediate steps to expand loan forgiveness programs for medical students who choose to become primary care or family doctors. This will help grow the primary care workforce. America has plenty of smart kids capable of being doctors, but not enough spots in schools to train them. We must stop artificially restricting the amount of doctors we train and start expanding medical schools. To increase primary care, we must also look to our nation's 3 million nurses and 270,000 nurse practitioners. These professionals are trained and qualified to provide critical care to services, but are banned from providing them due to restrictive regulations. Our nation should follow the example of states like Virginia, which passed a bill that allowed seasoned nurse practitioners to open up their own practices and provide medical care to their communities. Responsible deregulation can open up our medical system and connect more patients to primary care. As president, I will lift the regulations and funding caps that currently limit medical residents and other health professionals from entering the medical field. Provide loan forgiveness programs for doctors who go into general practice, especially in rural areas. Work to expand medical schools that focus on primary care. 4. Shift focus of care. Can shifting our focus of care help us reduce healthcare costs? Preventative care is a critical part of managing our nation's health. Whether that means going for an annual physical exam, eating healthier foods, quitting smoking, or exercising regularly, preventative care helps us avoid chronic medical problems that are the main drivers of healthcare costs. We need to stress the importance of preventative care and provide education on building healthy habits that'll help people live longer, healthier lives. Preventative care. Patients should have low-cost access to essential preventative care, like physicals and cancer screenings. By focusing on our citizens' health before they get sick, we can reduce the huge costs associated with managing chronic health conditions. In addition to more preventative health care, it is essential that we recognize the impact of factors outside of the clinic or hospital that contribute to health outcomes. We must teach healthy habits to young people and children. Eating an apple a day may not keep the doctor away, but it does promote healthy eating. Teaching kids the basics of a nutritious diet and providing them healthy meals at school and providing early screenings to identify flags like behavioral issues and different types of disabilities are key pieces in building towards positive outcomes. Tackling these issues early gives kids the best shot at leading a healthy life. 13.7 million children and adolescents and 93.3 million adults in the U.S. are battling obesity. Genetics is a factor, but so are lack of physical activity and consumption of ultra-processed foods. Exercise for people of all ages has been recommended by physicians to prevent and help not only obesity, but also cardiovascular disease, stroke, type 2 diabetes, many types of cancer, and depression. We have seen a significant reduction in the use of combustible cigarettes and tobacco, but there is always room to improve. Nearly 38 million American adults still smoke cigarettes every day, and nearly 9 million vape, not including the recent spike in the number of youth vaping. #VapeNation. The risks associated with smoking, whether combustible cigarettes or e-cigarettes, pose long-term health hazards that we must continue to combat. I'm sorry, he actually didn't say #VapeNation. That was me. I just felt that might be important to add in right there. I don't know why I did that. Low-income Americans are often faced with a terrible choice: buy food or pay for medical care. Increasing Americans' buying power through the freedom dividend will create great new demand for healthy grocers to open stores in food deserts. By alleviating constraints on access to care and to healthy foods, we can improve people's lives and reduce the amount of money we spend on long-term care. America is one of the most developed countries in the nation, but 41 million Americans face hunger, including nearly 13 million children. Food insecurity disproportionately affects households with children led by single women and people living below the poverty level. Other families are scraping by, but their incomes make them ineligible for any form of federal food assistance. Food security through public health intervention not only ensures Americans have enough food, it has the potential of reducing the development of malnutrition, cardiovascular disease, and other health risks. This extensive problem has a solution, but it needs the support of the food banks, clinics, and the federal government. We have to build programs that create partnerships between clinics and food banks to address food security and health. Indianapolis has implemented a program like this in 2017 and continues to serve an average of 135 households in the community. Imagine how many Americans we can promise nutritious food at the table by implementing this on a larger scale. I'm going to just do a quick break here and start to mention a little bit of what I know in terms of the data provided by Universal Basic Income studies, and that food and nutrition increase by a significant degree. And it's very important to consider the ways in which people make bad decisions based upon the scarcity mindset. When you don't have enough, you often will kind of cravings, if you will, and make poorer food decisions in terms of short-term gain, which is what the scarcity mindset completely facilitates. Let's continue along here. As president, I will encourage doctors to educate their patients about the importance of diet, nutrition, and physical activity on overall health. Incentivize integrated preventative care and healthy activities like gym memberships, biking to work, and consuming fresh produce. Offer incentives for food banks and clinics to partner together to promote food accessibility and reduce health disparity. Americans deserve better quality end-of-life care. End-of-life care should provide comfort and choice during this sensitive time while respecting the wishes of the individual. Despite the increasing population of aging Americans, only 30% have had end-of-life care discussions with their loved ones. We need to ensure that people head into this decision informed and with a clear plan so that they can spend their last days in a manner of their choosing, not at the whims of the healthcare system. Many providers try to prolong end-of-life care to get as much money out of the dying patient as possible. 8.5% of all health spending goes towards care for people during their last year of life, and families average out-of-pocket costs for end-of-life obligations of $11,618. Incentives under fee-for-service result in more use of end-of-life care for services, including more transitions among care settings, hospital days, intensive care, emergency care, and late enrollment in hospice. These kinds of services jeopardize the quality of end-of-life care and add to its cost. Access to palliative care decreases emergency room visits, increases patient quality of life, increases overall survivorship, and improves cost savings in Medicare programming because of proactive care. Increased knowledge and preparedness of end-of-life care will allow patients and their loved ones to make informed decisions about their care. 71% of Americans say that given the choice, they would prefer to pass away at home, yet only 25% do. We should give them that choice and guarantee that they will be properly cared for. As president, I will encourage providers to have direct and honest conversations about end-of-life planning, allow for patients and families to be more involved in decisions around end-of-life care, respect a patient's decision to choose home care even when it won't extend their life, take into account quality of life instead of just length of life for terminal patients, ensure that there are enough doctors educated about end-of-life and palliative care to provide effective treatment rather than acute medicine. 5. Coverage should include all aspects of well-being. What does comprehensive care mean? Once we control the costs of healthcare, we need to address the fact that current levels of coverage are inadequate. We must do more than just expand the level of services provided to all Americans at the edges. We need to ensure comprehensive care that includes all aspects of well-being, such as integrated mental health, sexual health needs, maternal health needs, care for person with disabilities, and dental and vision regardless of sex, race, or income level. Comprehensive care is not just a moral imperative, it makes economic sense. A robust healthcare system with comprehensive services, where everyone has accessible and affordable coverage and no one goes bankrupt, will build a healthier population and reduce our expenditure on long-term medical costs. Mental health coverage. This is a big one for me. I'm interested in this. Mental health is an important component of our overall health, and it should be treated that way by our healthcare system. There is a mental health crisis in America with 1 in 5 adults experiencing mental illness annually. Our life expectancy is declining due in part to increasing rates of suicide, especially among American youth. The teen suicide rate has gone from 56% in 2007 has gone up 56. The teen suicide rate has gone up 56% from 2007 to 2017, and it is the second leading cause of death for Americans between the ages 10 and 34. That's a nightmare. 7.7 million youth aged 6 to 17 experience a mental health disorder each year, but only half receive treatment. Anxieties and depression levels are at record high. People of color and the LGBT community also experience higher risk of mental health issues due to disproportionate social and economic challenges. Our veterans also do not receive the necessary mental health treatment they need when they come home. 22 veterans commit suicide every day, since many don't seek treatment due to embarrassment or shame. We need to destigmatize veteran treatment and support their stability to ensure a successful transition to civilian life. Substance abuse and mental health account for only 1 of 8 emergency department visits. Not only 1 of 8. Only 43% of Americans with a mental illness receive treatment due to inadequate insurance coverage and provider shortages. It is urgent to integrate mental health care into health insurance plans and destigmatize mental health care while encouraging an increase in the number of people able to provide treatment. Outside of mental illness, applying evidence-based stress relief methods in hospitals has been shown to shorten the length of stay. This is just one example of how caring for a patient's mental health has demonstrable cost benefits. By creating a healthcare system that recognizes mental health as an integral part of physical health, we can improve both. As president, I will integrate regular mental health checkups into primary care, provide new funds for suicide prevention and awareness competency training for school administrators and teachers, and provide greater access to mental health services in schools. Build the mental health workforce through an expansion of training programs and loan forgiveness programs for those that choose to provide these services to rural and underprivileged areas. Invest in veteran mental health and improve funding to crisis helplines. Utilize the current telehealth system to alleviate the widespread shortage of mental health care professionals, remove accessibility barriers caused by distance and transportation, and provide treatment to the privacy of patients' homes. Care for people with disabilities. Today, 1 in 4 adults have a disability in the U.S., but 1 in 3 people with a disability do not have access to a primary healthcare provider. Excuse me, my phone is doing it once again. I'm going to take a quick break here just to, drink some water, make sure that my voice box isn't going to go out on me. All right, looks like we're still good. Great. All right, we're back in action. Okay, but 1 in 3 people with a disability do not have access to a primary healthcare provider and has unmet healthcare due to high costs. I'm just going to keep going. People with disabilities are much more likely to experience secondary complications that exacerbate their medical conditions, and often need fast access to hospitals and treatment. Under the current system, these people disproportionately lack the access that they need because of high unemployment and homelessness rates, and higher rates of poverty. Additionally, there are issues with accessibility, both at healthcare provider locations and in transportation. 13.3 million children in the U.S. live with special healthcare needs. As the father of a son with autism, I understand the hardships millions of other American families face every day. Children with disabilities need a wide range of medical and long-term services and support that our current healthcare system does not prioritize. Either not all medical services are covered, or they are only available in limited amounts through private insurance. 47% of children with disabilities are covered by Medicaid or CHIP. Another 49% are dependent on private insurance, and the remaining 4% have no insurance at all. That is 4% too many. Early detection, intervention, and ongoing support is critical for parents of children with disabilities to understand and meet their needs. Our healthcare system should ensure all families have access to necessary experts and resources that equally uplift our children. We need to ensure that all people, including children and persons with disabilities, have equal access to healthcare they need. Outside of ensuring Americans with Disabilities Act's ADA compliance and at all healthcare providers and covering transportation costs, technologies such as telehealth will provide new and more convenient ways for persons with disabilities to access preventative care in a format of their choice and at an affordable cost. As president, I will ensure that hospitals are ADA compliant, make healthcare more accessible to people with disabilities through telehealth, while also ensuring public transit to facilities is accessible and covered by insurance. Ensure healthcare covers preventative care services for people with disabilities, like assistive mobility devices, hearing aids, adequate catheters, and sufficient physical therapy visits to prevent further secondary conditions. Ensure that all families have access to experts and resources for early detection, intervention, and care for children with disabilities. HIV and AIDS care. Today in the U.S., there are over 1.2 million people living with HIV and over 17,000 living with AIDS. Racial minorities, LGBTQ+ people, and the uninsured are among those who are most vulnerable to the impact of HIV. The truth is that major improvements have been made in treating HIV and AIDS that allow people to live long and healthy lives, but the exorbitant cost of HIV and AIDS medications has made treatment unaffordable for many. Nearly 30% of those living with HIV are uninsured and are not receiving necessary treatment. Additionally, PrEP medications are expensive and unavoidable to at-risk populations, despite the patent belonging to the Centers of Disease Control, CDC. Early diagnosis of HIV is essential to tackling this epidemic. It means better outcomes for people who are diagnosed and prevents further transmission. Planned Parenthood has been an indispensable resource for many Americans in this respect, particularly in rural areas. HIV and AIDS drug costs are thousands of dollars per month, despite the fact that they were developed using taxpayer dollars. The major corporation that owns these treatments, Gilead Sciences, has made remarkable profit off of these life-saving drugs, while many go without treatment because it's unaffordable. This is unacceptable. We need to make testing, as well as life-saving drugs for treating and preventing HIV and AIDS, available and affordable to all Americans. As president, I will bring down the cost of HIV and AIDS treatment through international reference pricing and public manufacturing facilities if necessary. Cover HIV and AIDS treatment. Break the patent on Truvada to provide low-cost PrEP to anyone who might be at risk. Provide funding for clinics like Planned Parenthood that can screen for HIV and AIDS, especially in rural areas. Reproductive and sexual health. Despite the $3.5 trillion spent on U.S. health expenditures every year, the reproductive and sexual health sector experiences some of the widest disparities in health outcomes. Under the current healthcare system, 1/3 of women in the U.S. report skipping needed medical care due to costs, and 1/4 of women who received care spent $2,000 or more in out-of-pocket expenses. Unfortunately, high out-of-pocket costs, deductibles, co-payments, and restrictive legislation have made it difficult for millions of women to access contraception, which reduces unintended pregnancy and abortion rates. Women do not casually decide to have an abortion. Abortion is an incredibly difficult and personal decision. Access to abortion, whether surgical by use of oral medication, is vital to the respect of women's own bodies and the right to life, health, pregnancy, and non-discrimination. The Hyde Amendment's ban on federal funding for abortions other than to save a mother's life or to terminate a pregnancy that arises out of rape or incest, along with stringent state laws, are a violation of women's privacies. Not only that, but inaccessibility to abortion increases their chances of poverty, unemployment, and dependence on public assistance programs, especially among women of color. The LGBTQ+ community is another demographic that faces discrimination in the healthcare system and is not provided quality reproductive health care. For example, in several states, gender-affirming healthcare and services are considered cosmetic and therefore are not required to be covered by many insurance plans. Planned Parenthood is one of the only organizations that provide non-discriminatory, knowledgeable, and respectful healthcare services for the LGBT+ community, particularly for transgendered people. The Title X gag rule threatens Planned Parenthood funding and 4,000 other family planning clinics across the country, which affects all demographics using these facilities for sexual and reproductive health services outside of abortion. Expanding reproductive health care will allow thousands of Americans to stay sexually healthy, limit the spread of sexually transmitted infections, and lower teenage pregnancy rates. In addition to the medical benefits, access to sexual health care furthers gender equality by empowering women to continue their education and pursue a fulfilling and economically secure career path. We need to cover the full spectrum of reproductive health care, including STD screenings, contraception, prenatal care, and abortion. It should also be inclusive of services related to transgendered people. Our healthcare system should encourage Americans to prevent and maintain or diagnose and treat their sexual and reproductive healthcare needs without fear of financial restrictions or stigma. Access to sexual and reproductive health care is just as important to the overall health and well-being of people's lives as is an annual physical checkup. As president, I will ensure Americans have access to comprehensive sexual and reproductive care, including STI screenings, contraception, and abortion. Ensure contraceptives and medication abortion pills can be accessed over the counter. Ensure access to non-discriminatory health care like gender-affirming services. Provide funding to Planned Parenthood by repealing the Title X gag rule. Repeal the Hyde Amendment and refuse to sign any budget including it. Maternal care. While the rest of the world is improving maternal care, pregnant women and new moms are dying in the U.S. at a multi-decade high. To make matters worse, the majority of the 700 pregnancy-related deaths each year are preventable. While this trend should terrify all of us, it is even more worrying for Black women, who are 3 to 4 times more likely to die from pregnancy-related causes than white women. This is unacceptable. We must ensure that every woman and mother has access to the maternal health services they need, and doctors have the training they need to save the lives of their patients. The U.S. has made strides in lowering infant mortality rates, but not enough attention or resources are placed on maternal care. Only 6% of grants for maternal and child health actually went to the health of mothers, and only a fraction of national obstetric research is focused on maternal health. We need to place more attention and care on expecting and recent mothers in our healthcare system. We need to ensure that every mother has access to the quality care that she and her baby need to thrive. As president, I will allocate more resources to maternal health research, fully cover all maternity costs, invest in implicit bias training for healthcare providers to ensure Black women receive life-saving maternal care, establish objective treatment guidelines for childbirth care to mitigate pregnancy-related deaths. Dental and vision. 74 million Americans lack dental health insurance, and nearly 62 million don't have any kind of vision coverage. This is large costs associated with it for people's health, educational, and economic opportunities. Oral health is an important aspect of overall health, and preventative care can prevent bigger, non-dental health issues such as endocarditis, heart disease. Regular dental visits can also prevent more costly care later on. Similarly, regular vision coverage can also help diagnose non-vision related issues, including diabetes, high blood pressure, and high cholesterol. Additionally, children who lack coverage can struggle in school when they have uncorrected vision issues, which frequently leads to behavioral issues. Preventative dental and vision visits can save emergency room costs, quite literally paying for themselves over time. There is no reason this coverage should not be provided. As president, I will ensure comprehensive care includes vision and dental services. Burden businesses. Health insurance in America is tied to employment because of historical accident. When Franklin D. Roosevelt froze wages during World War II to fight a labor shortage, employers competed for workers by offering various benefits, including health insurance. Since then, employers have become the primary sponsors of health insurance in the United States. We still have this system even though it has become a burden to businesses, constrained innovation and new business formation, and trapped Americans in the wrong jobs. Job lock. Today, many new jobs are temporary or gig work. One of the biggest factors driving the gig economy is the cost of insuring employees. Businesses spend thousands of dollars per full-time employee in healthcare costs, so to limit these growing expenses, many employers are choosing to hire people as independent contractors. This way, they don't need to pay for their healthcare. We need to give more choice to employers and employees in a way that removes barriers for businesses to grow. As president, I will explore ways to reduce the burden of healthcare on employers, including by giving employees the option to enroll in Medicare for all instead of an employer-based healthcare plan. 6. Addressing the influence of lobbyists. Is Washington, D.C. actually capable of passing comprehensive healthcare reform? The best interest of the American people is often not in the interest of powerful players in the healthcare industry. Healthcare has become a political animal in Washington, and the grip of these special interests make it almost impossible to draft and pass meaningful healthcare reform. Any attempt at legislation gets stalled by infighting and the intense lobbying efforts of industry players. With the magnitude of healthcare reform that we need, we cannot afford the interference of interest groups in our government. Private insurance, drug companies, hospital chains, medical equipment and manufacturers, and other private players all hold sway in Congress, but none of them represent the actual patients. For example, ridiculous drug prices are often terrible for citizens, but ridiculous drug prices are terrible for citizens, but great for drug manufacturers who currently have a lot of influence in Washington. This gulf between the power of the people and that of special interests is endemic in American politics, but especially toxic in the arena of healthcare. Expert advice is important, but limitless lobbying is dangerous. To pass meaningful healthcare reform, we need healthcare lobbyists out of the room. My plan to raise the salaries of government officials and bar them from transitioning into the private sectors that they regulated will help prevent the influence of industry lobbyists in my administration. To diminish healthcare lobbying influences on Congress, I will implement democracy dollars to supercharge grassroots campaigns and minimize the influence of lobbyists' campaign contributions. As president, I will refuse to hire anyone in my administration who formerly worked on it as an executive in the pharmaceutical industry or as a lobbyist for pharmaceuticals, medical devices, or private insurers. Provide an anti-corruption stipend for all members of the executive branch after the termination of their employment to be paid as long as they do not accept anything of value in exchange for advocating for a position to members of the federal government. Provide every American voter with $100 democracy dollars for each election cycle to protect their representatives from medical lobbyists. Increase salaries for government officials who regulated the medical bodies to much higher levels, but banned them from receiving anything of value in exchange for currying favor for special interests. This is the new way forward to fix the broken healthcare system in America and ensure every American receives the healthcare they need. Andrew. And then to be noted here, he has footnotes for each and every single thing that he cites within this very long healthcare proposal, which I greatly respect, and he does this for basically every single one of his policy proposals. So there you have it. That is a new way forward for healthcare in America, Andrew Yang's kind of in detail healthcare proposal. I had started this and initially kind of thought I'm not going to make any kind of judgment calls or really cover this in my opinion that much because this was my first reading through of the healthcare plan, and I don't like to really make any absolute statements on something that I'm reading out for other people. But personally, the things that I've read in this, I absolutely love. It's he's dealing a lot with the incentive structures of healthcare. And I think that's great, but in terms of the overall question of what do voters need to hear in terms of making them excited for Andrew Yang's campaign, because for many, many voters in this country, healthcare is a number one, voting point for them. I believe that's like the number one point for Democrats right now is healthcare. We get into the issue of just overall comprehension of healthcare. For instance, I know that a very large majority of Democrats want healthcare for all. They poll very well in wanting healthcare for all. Medicare for all. But when you ask them, do they want single payer, which is kind of the same question, that poll it goes down significantly. People, they don't understand the difference in all the terminologies. It's a vague concept to people. This is a obtuse and really just esoteric kind of field of knowledge. People want to get healthcare, right? They want healthcare to be a human right. If you have something wrong with you and you need to go and get it taken care of, you go and get it taken care of, and it's not going to bankrupt you. That is like baseline what people want. Personally, as a universal basic income advocate myself, My desire is that whatever happens, we cannot have healthcare continuing to be a drain on the individual's expenses, because it is something that you cannot avoid. Everyone needs healthcare, and you can pass a universal basic income, but for a large portion of people, if you haven't fixed our ridiculous healthcare spending, they're going to be spending that universal basic income on their bills. Now, I know Andrew Yang has said before that you cannot borrow against the universal basic income. So we wouldn't expect it to be like a mandatory payment taken out of the $1,000 that you're getting. Let me back up really quick. This is what I wanted to hear first and foremost. It's just like a very strong statement saying, you're going to get the $1,000 a month freedom dividend, and you can be safe and secure in knowing that this isn't going to be completely drained by any healthcare costs you might absorb if you don't have the privilege of having private insurance. And from what I understand, that is the base message, is that the costs are going to be affordable through the Medicare for All option that is going to be provided to every single American citizen. That is what I understand. The question is this going to be what other voters, especially the more progressive voters who have been holding off on Andrew Yang up until now, is that what they'll understand? And is that going to be good enough for them? I certainly hope that it will be. Unfortunately, I think as much as I appreciate this healthcare plan coming out, I think it's just a little bit too in detail, a little bit too esoteric for most people. And that sucks. That's just a way of life in our politics. We just need something very clear, very easy to understand. Time's going to have to tell on this one. I'm going to go ahead and just kind of maybe take a look at what people are saying in the chat, and we'll be wrapping things up here. Also, I'm going to ask a very quick question to people who might know a little bit more about YouTube than I. When I end this live stream, is it going to like automatically upload it as a finished video? That would be so cool, because I didn't record more than like half of this, and I don't want to have to go through and read all of this again. But I think this would help people kind of keep along for those of you at work who are just listening in and everything. So let's just take a look and see what everyone's having to say here. Someone agrees that they probably won't understand, and that's their fear. That is my fear as well. Someone's saying that Bernie has also folded to the social justice warrior left by publicly retracting his support for Cenk. Love him or hate him, which is just the wrong move. It makes them weak, and that's why they lose. I do think that it is really interesting, the kind of division, because Cenk, I can never pronounce it correctly, really stands as like the spearhead of the Justice Democrat movement, which has been just the huge force, especially through the last midterms when we got AOC and all of these young progressive Democrats. What's happened recently with Mr. Cenk is very interesting to keep along with. It's going to be a little bit difficult for me to continue finding things that are specific to the healthcare plan in general. That's why I'm hoping that I can get Superchat up and running so that it would be a little bit easier for me to curate through all of these comments. I'm going to probably wrap it up here unless anyone's got some specific things they have to ask me. I personally, overall, I'm happy with this plan. Now, for me, as a universal basic income advocate, universal basic income is the primary thing that I am searching for. My thoughts are we can expect one major policy platform to pass in the 4 years, the first terms of whoever is elected in 2020. My hope is that it's a universal basic income. And I say this because the difference between the scarcity mindset and the abundance mindset on a societal scale is, to me, what I have understood to be the root issue of the problems that we as a people, as a nation, as a world face. We are so divided, and we're divided by scarcity. We are still growing up with the same mindset that we are living in a world that existed 100 or something years ago, and that's just not the truth. The truth of the matter is that we have the wealth to be able to take good care of everyone in this country, to provide for basic needs, including healthcare, and someone who has been working in the scope of the meritocracy doesn't have to sacrifice any type of lifestyle that they've become accustomed to and feel entitled to. That's the major difference, though. But it's been weaponized that you cannot accept any kind of iota of abundance because you'll have to sacrifice and give up what you have. But that's only because abundance has straight up passed by us and continues to do so. And may I add, especially in the scenario of healthcare as well, I don't think people are very aware of just how tremendous the technological advances in terms of biomedicine and like telemedicine, as he was explaining there. These are happening at a speed which humanity has never seen before. I think that the leaps and bounds in personal health that we saw after the advent of penicillin and preventative antibiotics and soap and things of that nature that caused a population boom, those types of advances are happening now, and they're happening so quickly that we can't keep up with them. And with all of this comes abundance as well. With all of this becomes efficiencies within the ways that we provide care. And I think Andrew Yang clearly understands this. He's clearly a technocratically centric. That's like a smear word on him, but he understands technology much better than any other candidate on the stage today. And I appreciate that he approaches this with that angle. It frustrates me that other people, just immediately disregard Silicon Valley or anyone who happens to be more of a tech centrist leaning person in terms of the way that they view the world, that they would immediately disregard them. This is the reality of the life that we will be living in the next 20 and 30 years. And I love that he's spearheading these specific detail, incentive-oriented goals. I'm going to make some videos in the future on my own channel going into details on some of the things that I see in the healthcare industry that give me extreme hope, the ways that we can further democratize and increase the accessibility of things that are going to make people's lives better. How do we get there? How do we end the adverse maladaptive incentives that our current system is set up to promote and facilitate? That's exactly what Andrew Yang is pinpointing in on. The problem is that's a step removed from what people and voters today are comprehending and most concerned about. They just want to be able to not be bankrupted by our healthcare system. And it seems today that like every single candidate on the stage says, yeah, no, I agree with that. But do we want to get rid of private insurance? Do we want to do this and this and this and this and this? That's the only tricky part. Again, here, let me just take a quick look at some of all these things that are being said here in the chat. The only question that I have is, how does the Yang Gang effectively explain to detractors what Yang wants to do when it comes to healthcare that doesn't devolve into food fights? That's the thing, is it's just going to devolve into a food fight. People are going to hold in on this. They're going to grab it and say, listen, no, Yang is using the Medicare for All term in an incorrect way. It's not the exact way that Bernie's bill was set and targeted as itself. But at the end of the day, my entire thing is, question, if you need a program, if you need some healthcare, can you go get it? Can you afford it? And if you are primarily relying upon the freedom dividend in order to make ends meet, are you still going to be able to afford that and be okay at the end of the month? I want that to be asked to Andrew Yang. Like, that specific phrase, that specific sentence, I want to say, like, if for any reason a person has to rely on the freedom dividend, whether that be in lieu of other in lieu of other welfare services, if that's the case, will they be able to be taken care of securely and still be able to have that UBI provides enough value that we need? I know that $1,000 is the starting point, and my goal is for us to increase beyond that, and to bring me back to exactly why I think the universal basic income is the most important thing that we can pass in the first place, is because it will fundamentally shift the comprehension of what it means to be worthy or deemed necessary of aid or of help. And we have seen this in Alaska, where they have shifted the views of the universal basic income dividend that they get every month. The left and the right, they don't view it as some kind of like moral reception. It's no longer a thing that this person gets and it's coming out of my wallet and they're a parasite. No, it literally is like you're just playing a game of Monopoly. You get the $200. What can you do with that $200? So to me, this shifts the entire comprehension of what it means to be a giver and a taker in the society. And I think that we will continue to have a problem when it comes to how are we going to talk about Medicare for all as long as the zeitgeist of this country continues to be stuck in the question of givers and takers? We have to get beyond that if we actually want to reach the state of the society that many on the left want to get to. And I think because the division in the country, the separation between the right and the left is predicated upon that singular issue. I understand a lot of people disagree with me in how I view that and why I think a universal basic income trumps every other singular policy. But that's my overall point, is we have to do that. We have to do that now. It sucks, the system that we live in. The healthcare system we have now is FUBAR. I completely agree, but we are dealing with it now to an extent. Self-driving trucks are heading towards us fast. And I think that problem is going to quickly become more of an issue than our healthcare problem. And that's saying something. That is saying something. That's going to become more of an issue in the future. Okay, so all of that rant off here. Let's continue here. What the hell are you talking about? It literally leaves the details of the type of system, how to provide the coverage. Again, I'm not able to keep track of these unless I can curate them somehow. A mod might be nice. I feel like Yang should have talked more about how the American currently pays through the nose in the current Democratic argument around healthcare. Through the nose. That's a new term that I'm not used to. I think if he could have said, you may have to pay a copay. You may have to pay something or another. We're going to be providing a competitive cost program to you, but it's going to be limited at this much. Per month, you will max out a payment of healthcare that you need. If it falls under this Medicare for All program, you will never pay more than this. And that will ensure, in the scheme of the universal basic income, that we can be safe in knowing that it's not going to be just totally drained by healthcare costs. I think that we will move towards a system in which we can fully accept a true Medicare for all. You don't have to pay anything. It's all taken care of. But we have to get over the scarcity mindset first. The lowest common denominator is choosing our elected officials. Yeah, in a nutshell, that's exactly what I've been saying. I completely agree with that. Someone says, just vote for the guy. Trump said, what have you got to lose? I actually kind of feel the same way. Currently, as Bernie has turned his back on a universal basic income, there's really no one on the stage right now who is speaking about anything that would aid my struggle in life. I have nothing to lose. I will always vote for Andrew Yang. I agree with everything that he says. I disagree with many things that he says, but I see his platform as the way forward. It's the way forward. All right, y'all, I want to really thank you so much for joining along with my live stream. I am the host of The Dividend Report. I do YouTube channels. I have done live streams like this in the past, and I'm thinking that I may continue along and start some new ones up. I want to make sure that the recording has been all right and everything. I'm not able to post-process this, so I want to make sure that the quality is assured. It's weird seeing my face 2 times on this. So I will update on my Twitter account to let y'all know if I will continue to be doing updates, live streams, talking about day-to-day news. Follow me at The Dividend Report. At Dividend Report on Twitter. Make sure you're subscribed and you're hitting the bell here on YouTube. If you're interested in supporting my channel, I have some links in the video's description here that you may be interested in. What else can I say? We have to go and secure that bag and do it at all costs. I hope this has helped you comprehend Andrew Yang's plan a little bit more and gives you a little bit of information to be able to respond to people in social media or in real life. If you've got any questions, you can send them over to me on this channel. Leave some comments on the bottom. And again, if anyone knows anything specific about the recording, let me know. That would help me out so much. Yang Gang, thank you so much. Let's go secure that bag. Y'all have a great Monday and the rest of the week.